Thank you very much again for joining this webinar on climate and health journalism. So as climate reporters and as health reporters, we have noticed how these two fields come close, especially in the last few months. But this is something that was there way before. In the last few months, as I said, this pandemic, COVID-19, has changed much everything. Has shaken the foundations of lots of systems, lots of infrastructures, lots of mental and social structures that we thought were fixed, that we thought were unmovable. These times, however, it's very interesting how these times were not unannounced. We've heard the warnings from scientists, from activists, from indigenous people. We've heard the warnings many times that the health of the planet eventually translates into our own health, human health. And now we see a very direct example of how that connection shows. As journalists, we are here at Climate Tracker. We do our best to train new climate reporters, young people or who want to cover what we think is a biggest story of our time. And this is not disconnected at all from health. As we saw, this is one example that is the ecological degradation that turns into a crisis for our own health. But there are many other connections. One of these is, for example, the very similar attacks on science that we've seen both for health and climate science. But many others. Climate change poses a very large amount of threats for our health. We have seen how healthcare has moved from the depths of the newspapers and the news shows and into the forefront. Now healthcare stories open in basically every major newspaper in the world. They open every news show. We still don't see climate there, but definitely we understand these as these two crises as very interrelated. And I'm not talking just about COVID. It has been established that one of the main driving forces behind the pandemic is actually environmental degradation. As I said, the destruction of nature is behind health, much as climate. Health is a climate story, and climate is a health story. So whether you are a health reporter or whether you are a climate reporter, this webinar is for you. Today we have 3 guest speakers, and I'm very happy to have the 3 of them here. Thank you very much for making the time to join us. These are 3 experts in the fields of climate and health reporting. First, we have Arthur Wind. Arthur is a biologist and a science journalist who writes about climate change, environment, and migration. He currently works as a climate change and a health researcher at the World Health Organization. So welcome, Arthur. We then will move on to Carolina Gil-Posse, who's a communications and journalism professional based in Buenos Aires. She works in the nonprofit sector, where she has been working for the last for over 10 years. And before that she was working in journalism, and she currently leads Healthcare Without Harm's communication strategy in Latin America. She will be giving us a clearer view into the Latin American region. She also coordinates the Global Green and Healthy Hospital Network initiatives in the region, and she runs training programs on sustainability, climate change, and I can't believe I was muted. I was talking for so long. I am very sorry, and thank you very much to the person who told me through the chat. I will start again. No problem. Thank you very much, guys.
No, it was only the last few seconds.
Oh, it was only the last few seconds. Okay.
Yeah.
All right. Okay. Sorry. Oh, that's good. I don't know why it muted itself. Okay. So I was presenting Carolina. I don't know if that came in, but I will pick it back from there. So Carolina is a communications and journalism professional with who works in the nonprofit sector, which she has been for the last for more than 10 years. Before that she worked in journalism, and she currently leads Healthcare Without Harm's communication strategy for Latin America. So she's going to bring us a very specific view about the Latin American sector. She coordinates also the Global Green and Healthy Hospitals network initiatives in the region. She runs training programs on sustainability, climate change, and health. And then finally, we will move on to Daniella. I'm very, very happy that Daniella could make it today. She is a journalist working at Medical Gazette here in Spain. Medical Gazette is one of the most recognized health newspapers in Spain. But before that, she used to cover environment and climate change here in Spain, where she won several awards. And she, yeah, I was very impressed with her early work, and I'm very, very happy that she can be here to talk about the experience covering these two topics and the relationship between them. So without taking any more time from our guests, I'm going to give the floor to Arthur. Please, Arthur, all yours.
Thanks so much, Santiago, for that great introduction, and hi to everyone. There's quite a few familiar faces here. My name is Arthur. I'm a biologist and climate change researcher, and until 2 years ago, I actually used to work for Climate Tracker as well. I used to be a colleague of Dizan, although I don't think we've actually ever met in person, only online. And I think, Santiago, you were not at Climate Tracker yet when I was there. But that's a long time ago now already. I've been with the World Health Organization for almost 2 years now. I'm part of the climate change and health team here in Geneva in Switzerland. And as part of this team, we specifically support governments, mainly ministers of health, but also other ministries around the world in helping them to better understand what climate change impacts will happen to their countries, how climate change impacts will specifically will impact their health systems. And so how governments can be better prepared in dealing with these impacts. And then another aspect of our work is also to help them better understand what kind of health benefits they could gain from taking climate action. And this is, I think, is a very interesting part of the work because it can really help motivate climate action as well if they understand that taking climate action can actually have health benefits. And then personally, as part of the team, I specifically focus a lot on communicating the health impacts of climate change to a whole range of actors and to the wider public. It's super interesting that we're having this conversation. Maybe very, very broadly, I'll quickly touch on how climate change and health are interlinked, but I won't go into too much detail because it would be nice to keep on the conversation. But if there's any specific questions, then maybe we can also you can ask them at the end, and we can go into more detail as well. But just very broadly, we often divide sort of how climate change impacts our health personally and the health of those around us in three broad categories. One is very direct impacts. For example, heat waves or extreme weather events or sea level rise. Those are really, really direct ways in which climate change impacts will influence our health personally. A second category is already a bit more indirect. A very good example is air pollution, which is largely caused by the burning of fossil fuels. And so the fossil fuels that also cause the greenhouse gas emissions that cause climate change will also cause air pollution, which then can impact our lungs, can cause disease, can make our immune system weaker. And there's also, for example, a whole discussion now going on how air pollution could actually weaken our immune system or our lungs and make us more susceptible to diseases like COVID-19. That's a whole ongoing discussion as well. But so that's already a more indirect way of the same things that are causing climate change can also make us unhealthier. Another example is desertification, where droughts can cause deserts to expand, can make it harder to grow food, can make food scarcer, and so there can be food security. And a third example of more indirect ways is, for example, diseases like Zika or many other diseases that spread, for example, with mosquitoes, that with warmer temperatures or more humidity would spread to places where they usually would not be. So and there's many more examples of slightly indirect ways that climate change has an impact on our health in indirect ways. And a third one, which is one that is still going through a lot of research and a lot of debate, are more society-driven ways that climate change impacts our health. And two examples are conflicts, which is it's really hard to prove exactly that. For example, there's been a whole debate in Syria where drought has contributed to lack of grain and food resources, and that might have caused additional tension, which then might have contributed to the civil war in Syria. But it's very hard to prove exactly how much climate change has contributed and how much then, of course, that also impacts our health. A bit more of a clear example already is migration or displacement. And so again, there's a whole bunch of factors that play a role, but climate change clearly has a signature there and clearly impacts our health as well. So those are sort of the three broad categories, you could say: direct, a little bit more indirect, and then society-driven ways. Just super broadly, there's much more detail to it. And so that's one aspect of how climate change and health interrelate, the impacts. Climate change impacts also are often health impacts. The other side of that coin is solutions. Often climate change solutions are also health solutions. And that's, I think, something that would be interesting to hear from Carolina as well, because I know that at Healthcare Without Harm, for example, they work a lot on making healthcare facilities more greener, for example, by installing solar panels and so on. And I'm sure Carolina can speak to this better. So that often is a climate change solution, let's say. You're reducing greenhouse gas emissions, but at the same time, it could also be a health solution because you're creating healthcare facilities that are more resilient. And for example, if you would have a hospital with solar panels in the Caribbean and a hurricane would hit, and for example, the power would go down, it might mean that suddenly that health hospital with solar panels might be more resilient. It might still have its own power, so it could keep working even though a hurricane just hit and the grid might be down. So there's quite a few examples, interesting examples, where climate change solutions could also be positive for health, both directly by reducing emissions and, for example, reducing air pollution, but also by increasing resilience or providing more adaptation options to climate change. And so from a comms perspective, what's most interesting to me, at least, is not necessarily all the numbers linked to this. For example, how many people die of heat waves or how many people die of air pollution, which is really important and useful sometimes. But it's often also how these connections help climate change become more understandable and more personal for people, more related to their personal lives. And so from a communications perspective, that's a really powerful link to make. And then, of course, 2020, this year, we are currently in a health crisis. But in many ways, this is also some sort of, I would say, a dress rehearsal or almost a preview of the even worse climate crisis that is waiting for us. And so for me at WHO, from a climate change perspective, it's been very interesting to see how the current health crisis this year with COVID-19 has been intersecting with the climate crisis. And we can learn things that sort of are true for climate, but also for the COVID-19 crisis. And that could be useful also in covering the issues. And so I wanted to quickly just highlight a few of them, not too many. Of course, you can feel free to ask questions that we can go in more detail in as well. I think a a first interesting aspect of COVID and climate for me is that although we are in a health crisis, and this is extremely important that we give it the attention it deserves, of course, the climate crisis has not gone away. Climate change is still happening. There's still climate impacts taking place this year. And so we're dealing with several crises, and not just several crises next to one another, but crises that are intersecting. We have with climate change, we have a health crisis, biodiversity crisis. We are really seeing a crisis of equity and unequal situations, economic crisis as well. There's different conflicts in the world. So it's super interesting to see how all these different things are demanding our attention, and for an audience that can be very demanding as well. There's too much to keep up with. But for me, from a communications perspective, personally, I feel that we can no longer afford to report on just one crisis at a time. For example, say now we only focus on COVID, or now we only focus on climate. I feel like we're in a new stage now where all these crises are important and they're all interconnected in some way. And so I feel our job as a reporter or as a communicator is to cover these issues together and explore how they are connected. And I think a great example could be looking at inequality, for example. There's been a lot of interesting coverage recently that explores how unequal situations impact people differently in terms of COVID. For example, people who are living in poorer suburbs who might not have access to the same kind of health systems as others, or who might be more exposed to air pollution and so on. We've seen that they have higher death rates or higher impacts of COVID-19. So it's interesting to see how inequality and COVID have something shared. And the same is true for climate change, where we see that certain vulnerable populations will be impacted much higher by climate impacts than others. And so I feel like it's our job to start bringing these different crises together and explore how they're connected. So that's a first interesting thing I've noticed. Secondly, I really feel that 2020 has become the year of the here and now. We're in an emergency. There's need for rapid action. Politicians have to make a lot of big decisions, and it has sort of helped to move the idea of what is a realistic goal for politicians or not. So especially around climate change, often we've heard that climate change goals are unrealistic, or they cost too much money for politicians, and politically they're not realistic for them to do. And with COVID, all these arguments have just been wiped off the table. It's been proven now that, like, if it's necessary, politicians and governments can put in massive amounts of money to resuscitate the economy and to make sure that societies and communities are healthy and their well-being is a priority. So it's really great to know that we're in this new phase where suddenly they can't use this is unrealistic argument anymore. And similarly, the climate change impacts are also here and now, and they're getting worse. So there's still this sort of sense of emergency and action. And I think it's great to see how, or not great is actually not the right term, but it's interesting to see that health is a priority for people. So there's acceptance that that we need to move fast, and we need to make big changes to our lives. And so talking about climate change as a health crisis can also help doing the same for climate change, where people start to accept, okay, if we want to live in a society where everybody's safe and everybody can be healthy, we need to make rapid changes, and the government needs to spend a lot of money on things that are important for us. So that's the second part that's really interesting, I think, to explore in coverage. Thirdly, only a few more points, and then I'll be quiet. We all care about our health, and so making climate change a health issue or health crisis can help to make it more bipartisan or more apolitical. I mean, or at least it should. It's not always as easy, and I'm sure there's many countries where it's not as easy. But at least we can try to frame climate change as a health crisis, which could really help bring in audiences that we usually don't reach so easily, or also to sort of depoliticize the climate change discussion. A fourth point, and then one more point after that. We've noticed with climate change reporting or environmental reporting that or any reporting really, that we need trusted messengers for the messages that we're trying to get across. And in climate change, those are often scientists. Climate scientists are are generally well trusted. I mean, what they say is often believed to be true. There's a lot of science behind it, but often scientists are not the greatest communicators. So that's where we come in as journalists or communicators to really help translate the science, which has a lot of trust factor, into something that people can understand. But interesting here is that although scientists are very well trusted, health professionals generally, and there's been really interesting studies on this, health professionals are more trusted even. They're often the most trusted group or profession in society. Especially nurses and doctors, but also community healers. And so it's really interesting, I think, to explore how you can bring in these health professional voices more in the debate, because they are trusted and people listen to them. And I think that could be very useful, especially in more rural settings or rural areas, or because I'm assuming the health professionals are a bit closer as well to people's daily lives than scientists, which might seem a bit further away as well often. So that's interesting, using health professionals as a trusted messenger as well. And then lastly, and I hope we'll go into this a bit more detail as well in the rest of the call, the COVID crisis, and especially also the climate crisis, has really sort of shined a light on the deep inequalities that we have in our societies, and how vulnerable we all are to shocks that leave so many people behind. So I think inequality has really become the story that will bind the climate crisis and the health crisis together. And I think it's quite an exciting time to be a journalist or a communicator, to look at how vulnerable population groups are suffering from the unequal system they live in, and how that also impacts how climate change will make that worse, how this health crisis is that making it tougher for them. And so our job to raise these voices and give these voices a face, make these voices heard, I think is quite an exciting job ahead of us. So I'll leave it here, and happy to answer questions in the chat and also have a discussion later on. Over to you, Santiago and Carolina.
Thank you very much, Phil. I wrote down a few questions for you, so hopefully we'll have time at the end of the call. If anybody wants to ask Arthur a question, I think the best way is to type it in the chat, and then we will take them in order when we have finished the three presentations. Now we're going to move on to Carolina. As I said, Carolina is focusing specifically in Latin America. So I think this is very interesting, not only for people working in Latin America, but for anybody taking a look at the global south and the specific challenges that both climate and health pose there. I'm going to move on and give Carolina the floor. All yours.
Well, first of all, thank you, Santiago, for the invitation. I am very pleased to share this webinar with Daniella and Arthur. Just to add that I am a journalist. I worked for 18 years in media, mostly radio, and I have been researching on climate change media coverage from a health perspective in Latin America during my master's in journalism, and now as a PhD student in social sciences at the University of Buenos Aires. So this is something that I really love to talk about. Why does framing matter in climate change news? Arthur has just presented a very detailed some arguments around this. We already know how the impacts of climate change are affecting our health, not only directly, but also indirectly and in other events as conflicts, migration. Media is also understanding that people should also be key characters of the climate stories, if we see how the media coverage has been changing throughout the years. And let's talk about where we are in terms of media coverage of climate change. Let's see what this data from the Media and Climate Change Observatory at the University of Colorado in the US shows about news articles that include, for example, two basic keywords, climate change and global warming. First thing to say is that coverage was most abundant in history in November and December in 2009. This has to do with the COP15 in Denmark. Then last year in September and December also, because of first the climate strikes, the UN Climate Week, and then COP25, meant to be in Chile, but then really happened in Spain. Those were the highest level globally in nearly a decade in terms of media coverage of climate change. Then you can see there COP21, this milestone in terms of the international negotiations around climate change. But then we have COVID, and it breaks a previous trend of increasing coverage. So according to this report, July has seen a 5% uptick in media coverage of climate change, but still at levels around 37% lower than a year ago. So in terms of the content, ecological, meteorological themes drove media coverage of climate change in July, for example. This has to do with historical temperatures and ties to a changing climate, extreme heat in Russia, in the USA, and in other parts of the world. But in Latin America, we can see a similar picture with these milestones. Of course, COP16 in Cancun, Mexico is another milestone in terms of media coverage, but then also we have COVID. So there is another observatory that goes more into how many articles, how many of the articles that are published are actually focused on climate change. And in Latin America, according to this monitor, Radar Climático from Conexión COP, it's only 0.07. So it's really, really low. But at the same time, as we know, climate change really matters to most people. According to the digital news report from Reuters Institute at the University of Oxford, that has been launched this year, based on a survey of over 80,000 online news consumers in 40 countries, on average, across all markets, around 69% of respondents stated that they consider climate change to be an extremely or very serious problem. They also explore in this report the different sources of that people use to learn more about climate change and how this is affected by age, education, political affiliation. And the data shows that people pay far more attention to television when it comes to climate change than to other media. Probably this has to do with other previous research that reflects the power of the moving images to stir emotions. But when it comes to media coverage, we should not only analyze quantitative data, but also frames. In words of Robert Enman, to frame is to select some aspects of a perceived reality that make them more salient in a communicating text in such a way that it promotes a particular problem definition, the interpretations about the causes of this problem, moral evaluation, and other treatment recommendations. And we know that climate change has been historically framed as an environmental or a political issue in the latest years, but the research shows that when the news media focuses on health impacts of climate change, it brings the attention to science, for example, to risks, but also the coverage shifts the public train of thought on climate change to a dimension of the problem that is more relevant in terms of more personally relevant. So at the same time, we know that climate change is here it is, that climate change as a problem does not generate more engagement. And we know, according to the Lancet Countdown report, that media is starting to see this link between human health and climate change. So health can help us to humanize climate change. But the question is media contributing to this framing right now? And the truth is that we lack information about how the media represents climate change as a human health issue. There are a few examples of some research, like this one that is focused only on health impacts and US newspapers. Then there is another research around Peruvian newspapers that also considers human effects, meaning direct impacts on health of people of climate change. But we understand at Healthcare Without Harm that like our mission is to transform the healthcare sector worldwide so that it reduces environmental footprint but becomes a community anchor for sustainability and a leader in the global movement for environmental health and justice. Healthy planet in healthy people is our main statement. So the questions that we have are, how do we help journalists in Latin America, especially in my case, to include this health frame as a strategy to drive the attention of audiences to climate stories? What obstacles are there in the newsroom's production routines that hinder the health framing of climate change in the news? How can we help to address them? And how do, at the same time, how do we leverage the role of health professionals as trusted sources of information for journalists who cover climate change, as Arthur was just mentioning? So we are working in collaboration with different networks of journalists in Latin America, like Latin Clima, Periodistas por el Planeta, national associations of scientific journalists. We have organized 2 workshops last year in Colombia and Costa Rica on health framing of climate change. We are developing right now a guide for journalists in Spanish, because we also acknowledge that there are a few resources in our own main language. This guide is going to be written by journalists with general recommendations that we're going to provide, but also specific chapters on scientific journalism, health journalism, data journalism, and energy. It is going to be released in November, and of course you are invited to join us in that online workshop. But then we also work with healthcare professionals. We train them to become climate change communicators. We have launched an online course this year on effective climate change communications. Last year, a training program on leadership, also both virtual, both free, and in Spanish. And then we organize other activities like this interactive workshop that is going to happen in 2 weeks from now. So again, you are invited to join. We are going to have this interactive session in addition to hearing from a top WHO official and frontline leaders from United States, India, and South Africa. You will have an opportunity to share your own ideas about the challenges and opportunities at the critical intersections between climate, health, justice, and the COVID recovery, of course. So, as Arthur was mentioning, we have developed this healthcare climate footprint report, where we not only estimate the carbon footprint of the health sector globally, that just to say that if it was a country, it would be the 5th major emitter globally. You can see more details in this report, and also some actions that we recommend and suggest for healthcare systems around the world, ministries of health, environment, energy, to advance the climate action. This report is published in Spanish and English. Also, in terms of the good stories, and also this trend about solution journalism that is driving coverage around the world related to climate change, you can go to this report that summarize the work that some hospitals in our region are doing around climate action. Then there are other resources that we usually share in our workshops for journalists that, of course, you are invited to check. And of course, remember that in November, we're going to have our own guide for journalists. And finally, 2 quotes. One from Ed Maybach from the Center of Climate Change Communication at George Mason University in the US. He says, "We can summarize climate change in 10 words. It's real, it's us, experts agree, it's bad, but there's hope." And then the last one from Cristiana Figueres, former Executive Secretary of the UNFCCC, during the WHO Assembly in 2016. She said, "There are 2 links between health and climate change. The first is that in addressing climate change, by reducing emissions, we prevent the worsening of health conditions around the world. And the second is that by improving the many different conditions that can be improved through climate measures, such as food security, water safety, we are actually improving health conditions. In other words, the Paris Agreement on climate change is actually an agreement on public health. And this is something that every climate journalist and even every journalist should always have in mind. Muchas gracias. Thank you.
Thank you very, very much, Caro. That was extremely interesting, and well, I'm really, really impressed about the research. I'm sure there will be plenty of questions. I sure took a few for later. And now I would like to introduce you all to Daniella Gonzalez. She is, as I presented her at the beginning, as I introduced her, she's a Spanish journalist. She's a very young journalist. Okay, so Daniela, you have been both a climate reporter and a healthcare reporter. And I would like to know, in your experience in newsrooms that work with both environment and health, are, in your opinion, have your colleagues been aware of the connections between these two fields, and have you seen any change in that experience?
First of all, hi everyone. It's a pleasure to be here with Carolina and Arthur. So thank you for that. And I am going to try to explain a little points about my little experience. So I really want to help people that it's starting in the journalism to cover environmental things, health things. So I hope to be helpful for you. At the beginning, like you said, the health of planet and the health of people, they are two topics that are increasing the interest of people in these years, sometimes jointly, sometimes separately, but they are doing. So, for example, I think, under my experience, that when we talk about climate change and health, we talk about issues like pollution, like malnutrition, like heat waves, infectious disease, but many times some people forget to talk about healthcare systems and how can be they can be collapsed. So I think this is a point very important. Sorry, I am a little bit nervous. And I think that, for example, right now we are in front of historical moment, because with the arrival of COVID-19, we can make the connection between climate change and health. So climate journalism plays a crucial role right now. For example, when the pandemic began, a lot of media talk about the transmission of the virus in a market in China. Okay, a zoonotic disease, everyone knows that, but people doesn't understand why it was transmitted, you know? So I think that it's very important to make people understand why this is happening, you know? So in order to avoid this kind of things in a near future. So I think this is very important for journalism and for journalists like us. So for example, according to a report of WWF, the destruction of nature and the loss of biodiversity increase the risk of infectious disease. So for example, with COVID-19, we can connect with people and try to change their minds, to make the click in their minds, you know? So for example, one day I interviewed a scientist of Spain, Fernando Valladares. It's very recognized here. And he told me one thing that it surprised me. He told me, Daniela, could you imagine that the coronavirus had the lethality of Ebola? Couldn't we hold it? And it was like, oh my God, I didn't think about it, you know? So for example, today there are more and more studies that determine that health and of the planet is directly relation with health. But why is this happening? At the moment of nature is altered or destroyed, the balance of organisms, viruses, and bacteria is broken. So they are living in it, in the ecosystem, like us, like humans. So at this point, we can say that climate change has a double factor of action. On the one hand, it has a direct impact of the health, people's health, and the development of diseases. On the other hand, it favors the spread of viruses and bacteria. But how can we talk about climate change and health? When Climate Tracker contacted with me, I thought to talk about all these kind of things, and I really want to express a little difficulties that I found when I start. For example, when I started journalism, my main priority was to talk about climate change and human activity. Climate change and human activity. I was obsessed, you know, but I was very, very lucky, and I was able to work in FA News to cover environmental things and to talk about the main issues and the main topics. My surprise was when I finished the scholarship I won there, and I had to look for a new job. So I start my experience in Gaceta Médica in Spanish, Medical Gazette, and I realized that a lot of news of climate change can be related with health. And at the beginning, I was very, very scared because I was like, oh my God, I didn't have the sources. I don't know the interest of people in health. I was very, very nervous, but when I was starting, I realized that I can use my own sources on covering environmental things to health, because it's very, very similar. And yeah, for example, when I try to select the sources, I think it's very, very important to ask all the parts. Because, for example, I think that if you are here, you are concerned about climate change and you are concerned about health. So these kind of things can't influence your information. You have to try to know all the opinions, all the sources. They are this kind of information is going to consolidate your information, and it's going to be strong. So how to talk about climate change with health perspective? From my experience, I can tell you that people want to read topics that touch them. For example, here in Spain, people don't care, you understand me, don't care about pollution in New Delhi, about pollution in Beijing. No, no. People want to know if they are going to be safe in their own streets, if the pollution is going to hurt their babies. So if, for example, their houses on the beach is going to disappear or something like that. So I think that it's very important to connect with people with news that they can see, they can touch, they can feel, you know? So this is in our hands, like climate journalists. We can connect with people, and as I said, one of the main issues is pollution, air pollution, and it's also called the invisible killer. Kills about 9 million people each year and leads to heart problems, strokes, even cancer. In order to talk health and environmental in your cities, it's very important to have the right sources. For example, I really want to share with you some sources that I use, like, for example, World Health Organization, of course, Arthur. It's one of the most important. The ministries of environment in each country, it's very important because they have a lot of information. Non-governmental organizations like, for example, WWF or Greenpeace, they have a lot of documents each year, so they are very, very helpful, and they are going to help you if you need it. For example, climate change observatories, I use that. Scientific societies, I think, is one of the most important, because people want to know the opinion of experts, but if they are in relation with health, they are going to be better, because here in Spain, for example, we have the Spanish Society of Pulmonology and Thoracic Surgery, and societies related with oncologists, and people really want to read information related with environmental experts and health experts. So if you can contrast all the information, it's going to be better for you. For example, another thing that I really, really love it's the prestigious journals, like, for example, Science, Nature, The Lancet. There are many articles published, and they are highly recognized. So this apports a lot of credibility in your information, and the people really want to read that. One source that really helped me sometimes was the European Parliament and the European Commission. Don't be afraid, you can call them, they are going to answer you. And they are very, very nice, and sometimes they can give you more information by email or by telephone, so it's very, very good. Um, another thing I want to tell you, it's the way to connect with the reader. From my experience, I think that one way that works very, 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 very well, it's to put a protagonist in the story. People want to sympathize with the story and with the information. So this kind of info works very, very well to info. Another advice that I can give, it's, for example, if you are going to interview somebody, if you can use multimedia items, it's going to be better, because you don't know when you are going to use this information again, and social media exists, so you can move it there too. In addition to having the right sources, from my experience, it's very, 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 very important to be careful with comparing studies. Imagine, for example, that there is a super study made in India, and the news says if the numbers of cars were cut in half, mortality will decrease like 20%. Imagine, okay? When people read it, they think that they can take it and use this information in their own cities, and this is incorrect. We can be very, very careful with that, because when you mention that, it's very important to point out which university made it and under what conditions they made this study. Pollution levels are not going to be the same in each city, so we have to be careful with that. Another difficulties I have sometimes find information about environmental policy. There are a lot of proposals, there are a lot of documents, and there are a lot of things that it's a little confused for the people. So you have to study. You have to sit down and put in front of the documents and look everything to try to recognize the information and try to know what is new here, you know? And if you don't know that, don't worry. You are not the expert. You are the journalist, you know? So ask people, call people. Don't be afraid about that. And yeah, I think that this is the most important advice that I can give. So if you need something, you can ask in the chat or something like that. So thank you.
Thank you very much, Daniela. Yes, I will open with a question for Carolina, just to break the ice and let the rest of the audience come in. Well, you were mentioning how COVID-19 coverage has broken a tendency, a trend to an increased amount of climate coverage in media worldwide. From my point of view as a journalist, this is probably related to a tendency in the media to focus on immediacy. Whatever is very obvious, very quick, and has very rapid consequences. Of course, as a climate reporter, I know this is true also for climate. But can it be, or could we improve our communication of climate so it actually represents the urgency and the immediacy that it actually has? But often we don't. Do. How do you think we could improve this?
Thank you, Santiago. That's a really interesting question. The first thing to say is that right now the best way to publish and to cover climate change is going through the links between climate change and COVID. That's like, it would be an easy conversation with your editor if you have to suggest a story that links both subjects. At the same time, what we are learning now on how journalists are working is that this is really a topic that is being covered by every section in every newspaper and in every radio or television. So that was something that the research shows, that one big opportunity for climate change coverage is to make it something that is interesting for journalists that cover politics, economics, international, everything, sports, even sports. If you think about heat waves and how does that affect sports. So what we will learn from the COVID coverage experience is that climate change is also something that can be covered as a cross-cutting framing, for in every section. And then how do we manage that? Because of course, the urgency is something that is very valued by editors, by journalists. If you can show the urgency, that's something that probably is going to be in your cover page. So then we need to think it further, and we need to find the ways to not only talk about impacts, especially after COVID, the audiences will be already, journalists have been talking about impacts and COVID and emergency and health impacts of the pandemic for more than a year, probably. So then if you continue as a journalist talking about the impacts, well, maybe that's not the best way to frame it. Instead of that, we have the opportunities of the climate actions, co-benefits of climate actions that are related to health. That's really, really something that needs to have more coverage. Also, collaboration between journalists from different regions that can address some direct or indirect impact of climate change in a certain region, but that can also show and hear solutions. Journalists is an opportunity. How governments, how the healthcare systems, how they are building resilience to be prepared after the pandemic to receive the impacts of climate change. So I think that those two ways of thinking about this, especially around solutions, and it's not, it's not telling happy stories. It's showing how in a system level, governments, ministers, NGOs, civil society is addressing this challenge and is providing responses to that. I think that that is something that journalists can use for their stories, and especially when they think about how to frame climate change from a health perspective.
Thank you very much, Caro. I don't know if there's anybody else I would like to ask a question here in the chat. But meanwhile, I will throw another one to Arthur that I have here. And it's very interesting that you work at the World Health Organization, which has passed from being a source for many of us to being the main character in one very sad story. This the attack on science from the American government in this particular case. This is not an isolated. It's not an isolated. It's not an isolated case where we have seen, attacks on science, and we have seen from this particular administration attacks on climate science with very similar strategies. When Donald Trump announced that the U.S. was retiring from the Paris Agreement. How do you deal with this? How do you deal with promoting science in this environment, promoting science communication and effective science communication in an environment of aggression from the highest possible distances?
That's not an easy question, and you're right. It's been quite a sad story, and almost it reminds me of the telenovela a little bit, episode after episode, further away from reality. And yeah, I'm not sure if I have a concise answer, but I think it's interesting to see how until recently at WHO we would never have to focus on disinformation, and now we've had to really make a big point of whatever we communicate, and we communicate usually about, for example, the state of COVID in certain regions and countries, and the newest science, the newest guidance. And suddenly a big part, I would say maybe a third of all the information or communication we share is about disinformation. How can people learn and understand which information is true and which one is not? And I think Daniella also spoke about this, which sources should I be using? Which ones are most trustworthy? How can I have a list of sources that I always return to? And it's true that it's something that most people, and I'm also not the best in this, have not really learned how to be really good at deciding, is this trustworthy information or not? You know, it's not something that we know, that we just learn, that we just know. We really have to learn it. And it's not something that, for example, the school system really teaches us, or it's not something that we see much online, even how to know if online content is true or not. What if I share it even though I don't really believe in it, and especially even also on WhatsApp and so on. You see so many things that are just shared without people even thinking about it. And so us creating some sort of etiquette, and this is true for health information now, but it's just as true for climate. So it would be interesting to see, because everything is sort of speed up now, with COVID, if we learn a few things here, like, okay, which health information can we trust, and what kind of rules do we set up for ourselves and for sharing information with others, both as journalists, but also as personal internet users, that we can also try and use more for climate reporting and climate science. I mean, sorry, this is not really a clear answer, but it's a very good question, and it's something that we'll definitely have to learn as we go along.
Thanks a lot, Arthur. And we don't have questions, so I'll just throw one. Oh yeah, we have a question here. Yes, this is for Arthur. Diego, is it a question for Arthur? Could you please let me know whose question? Who are you? How would you like to answer this question? Okay, thank you for the conversation. What's the best situation we can get if we share the climate stories properly? Okay, it's for anyone. When the people know the truth about climate change, what should happen? Okay, so I think I would like Caro, who's a researcher on climate communication, to get this question. Caro, would you like to take the floor?
Yeah, thank you. That's a really interesting question. I think that we can provide the answer thinking about audiences in terms of individuals, but also in terms of the public agenda and the discussion. And I would like to refer to this second option, because we are not going to save the world by moving from one city to another in bicycle. I mean, that's really good, and we need to do that, but we need public policies that support that change to other ways of getting people from one city to another, you know? So, and I think that in terms of health and climate change, we need to bring health to the climate policy, and we need to bring climate to the health policy. When we discuss whether we, I don't know, put money for example, let's go to a hospital. If we need to build hospitals to respond to a pandemic, how that hospital is going to work in terms of energy consumption, that's a decision that in the long term has an effect on health. So if you make the decision from the very beginning, considering the health impacts, then you are addressing two main challenges that you have. So the summary of the answer would be health in climate and climate in health should be the guideline for every discussion, and media and journalists have there a really, really good opportunity to influence public agenda, not only audiences and perception and risk communications, especially for those who are directly impacted by climate change. But if we need a society that claims for more climate action, and for that we need audiences that are informed on climate change, and I think that that's the path that we can imagine to move forward to the solutions and to try to have, again, healthy planet with healthy people.
Thank you very much, Caro. For answering Diego's question, I would also like to pitch in a little bit. I think your question is very important, because after all, when we tell stories and when we act as journalists, the goal at the end is to create an effect, to create an impact on society. And I think in this case we need to be very resilient, because I think the effects are cumulative; they are not immediate, and we need to be really resilient and very patient, and wait for the effects to sum up. I also think that we live in a very outdated media landscape that follows almost 19th century models, where we're not very well equipped as media systems to deal with this kind of global problems. We still have a focus that primes the immediacy, both in time and in space. And in this case, this is a problem for reporting the severity of the climate situation. So we're out of time. I would like to ask one more question to Daniella, if that's possible. But this will be the last question, and I would like to thank you all in advance before I do this. Daniella, yeah, you're a very young journalist, I was saying, and you have worked in a very short period of time already in two big newsrooms, two very important newsrooms for both environment and health. You have worked with very experienced journalists in both fields. Do you see the older generation, let's say people who are now in the mid to late careers as journalists, do you see them understand these links between healthcare and healthcare and environment topics? Do you think they are adapting to this new paradigm?
But environmental journalists or journalists in general?
Environmental journalists on one side and health journalists on the other side. Do you see each of them understand, like, willing to be working towards that intersection?
Okay. at the beginning, for example, in my newspaper, in the newspaper where I work, they didn't write a lot about environmental things, you know. So when I was hired there, they gave me the section, you know, you are going to write about climate change and health. So I think they realized that this is going to be big, you know. So I think that, yeah, I know that I have a short experience in this field, but all the people that I know, I think that for one part, for environmental part, all the people are concerned about health because pollution, because infectious disease, for all that reasons. And on the other hand, for health journalists, I think that this is a topic that is waking up, you know. So a lot of young people, they are on the street. A lot of people is increasing this present to the politicians. And for example, the climate emergency in the parliament or something like that, this kind of things, it's going to be big. So people is connecting everything to do their best. For interest, like for example, big companies, now everyone is green, you know. But yeah, I think that everyone is doing the connection, better or wrong, but all the people is doing that. So this is very, 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 very good.
Very, very optimistic, Daniela.
Yeah.
That was a very good note to leave this in a very high and optimistic, with a very high and optimistic message. So
I am young, so
yeah, you are, and a very good journalist as well. Well, thank you very much to all of you who have joined us here, who have stood the unfortunate problems we've had, and who have stayed to the end. Thank you to our three guests. I'm very happy that you were able to join us today, and I think this will be a very valuable resource going ahead. I will let you know as soon as this is edited, of course, and uploaded to the website. And to the rest of the audience, if you have any more questions for the guests, my email, I will write it here, is Santiago at climatetracker.org. You can take a note of that, and you can reach out to me if you have any more questions about this topic. I will do the best to address any of your doubts. Thank you very much again, and I wish you a very good rest of the day wherever you are.
Thank you.
Thank you.
Santiago.
bye bye.
Bye,
Thank you.
Arthur.